Could you introduce yourself and share what first led you to focus on airway health and sleep disordered breathing in your professional work?
So hi everyone, my name is Dr. Meghan Chard. I'm a general dental practitioner. I own a practice in Surrey with my husband, Dr. Simon Chard, and I've been a general dental practitioner for the last 14 years. And where it all started for me was I remember doing a snoring course on adults, so I could provide them with a snoring device. And in fact, actually, it started before then. I actually did a postgrad diploma in sedation. And actually, from there, I sort of learned about the importance of the airways, keeping them open, sort of specific head positions when you're sedating patients, and learning about, a buildup of carbon dioxide and, all the sort of the chemoreceptors in the body. So that's kind of where it all started. I then did a snoring course and sort of learned again about the importance of kind of keeping the airways open, oxygenation, obstructive apnea in adults and screening for them. So that's kind of where I first started. And in general, I'm really into sort of health and longevity. I work out, I exercise every day, I sauna, ice bath, I try and eat healthily. So I'm all about optimization and living the best life as an adult. And I actually think really good habits start as soon as children are born. So, we want them to brush their teeth, eat healthily, drink water, exercise, sleep well. So all these really key pillars of health, you need to start early to optimize children's lives so that they grow into being healthy adults. And I've always loved treating kids, but I didn't really know how to help them with certain issues that parents would bring up, which I'll talk about later on.
Yeah.
But it was only when I started reading Breath by James Nestor, that was the first moment where I really understood the importance of nasal breathing and airway health, and sort of the detriments, I can't say the word, the negative impact, should I say, of mouth breathing. And then sort of from there, it led me to other books and other research papers and other online courses and, all these sort of different things. And all of a sudden it opened up my eyes to the world of sleep disordered breathing in children. And I could actually link sleep disordered breathing in children with my own children. I was seeing that personally in my own personal life, and seeing how the sleep deprivation and these issues can affect our children. It can impact them, the way they think, the way they behave, the way they learn, the way they, their immune system. And I was sort of experiencing it firsthand with my own children. And so that's kind of where my journey with this topic has begun. And I'm really, really passionate about it.
Thank you. And what are the key signs and symptoms of sleep disordered breathing that dental professionals should be actively screening for routine examinations?
So once you learn about this topic, you actually can see loads of signs and symptoms in children. And you can see them from as soon as they walk in through the door.
Really?
You can see them when they walk past you. You can start noticing things. But I would say the main three, like three just quick fire ones that general dentists can look out for, would be number one, tooth wear in children. Or the parents are saying that they can hear their children grinding at night. That's the kind of the biggest red flag, I would say, because tooth grinding is actually linked with sleep disordered breathing issues. There's been lots of studies that show that children who've got big adenoids and big tonsils, which are blocking the airways, and they grind their teeth before the surgery, and then after surgery, i.e. the airway, the obstructions are cleared, the grinding dramatically reduces / resolves. It's also linked in, tooth wear is also massively linked with adults who have sleep apnea and snore. So there's a big correlation there. So I would say number one is look out for tooth wear in your children patients, which now that you know that, or now that dentists know that, it will be rife. They'll see it in most kids. Second of all would be a lack of spacing in the baby teeth. So, if the baby teeth they look perfectly straight already and there's no gaps, then it means that there's not going to be enough space for the adult teeth to come through. Therefore, something's not quite right. The child's off the right track, and they're going to have crowding and they're going to have issues. And then the third big sign I would say is looking at the shape of the palate. Is the palate nice and wide? Is it gonna make enough space for the teeth to come through in a nice way? Or is the palate really high, really narrow and really high vaulted? In which case they're more likely to have crowding. That means the tongue isn't shaping the palate properly. So therefore there might be issues with the tongue, the tongue's not doing what it needs to be doing. And so those are kind of the three main signs I would say to look out for.
Okay, so then in that case, from your experience, how can untreated sleep disordered breathing affect patients' overall health, quality of life, and long-term systemic well-being?
So basically, having sleep disordered breathing is a spectrum, and it ranges from sort of mouth breathing, snoring, upper airway resistance to sleep apnea. And sleep apnea is obviously the most severe end of the spectrum, where the airways completely close. So and this happens with all populations. So in children, all the way to adults. And the issue with sleep disordered breathing, it means that there's reduced oxygen to that person while they're sleeping. So there's a sort of an altered breathing technique. So therefore, reduced oxygen means there's less oxygen getting to the brain, and that means that that person cannot get deep restorative sleep. So that sleep is being constantly fragmented. And so what does that mean for that person? Well, if they're not able to get deep restorative sleep, then it means that basically every single system in their body is affected, because it's
Mhm.
such an important process for us humans. We can't live without sleep. We will actually die without sleep. So if you're constantly sleep deprived and you're getting poor quality sleep, then there's so many things that are going to happen to you as a person. So first of all, you'll have cognitive decline. You're not going to be able to think and process, cognitively the same way. So, you know, there's been a study on sort of 10,000 children who snored, and they had grey matter loss compared to children who didn't snore. So you'll actually have brain, your functioning will be reduced, but you'll actually have less grey matter. Not only that, during deep restorative sleep, it's when your body actually physically repairs. And it's also when your immune system is strengthened. And so if you're not getting deep quality restorative sleep, then your immune system's going to be affected. And in fact, Matthew Walker, who was like a world-renowned neuroscientist, he
Mhm.
actually said that if someone is only getting 4 to 5 hours sleep at night,
Yeah.
that day, their natural killer cells, so these are the cells that you produce every day, and these cells are your immune cells, part of your immune system, and they're involved in detecting and killing cancer cells. So in a person who's only getting 4 to 5 hours of sleep at night, their natural killer cells numbers reduce by 70% on that day, the following day. So that just goes to show that, if you're sleep deprived and not getting good quality sleep, your immune system is massively affected. And in fact, nighttime shift workers, they've got a higher chance of getting cancer because their sleep's affected. So essentially, yeah, if you're not getting deep restorative sleep, your immune system's affected. When you're a child, you're growing so much. There's so much rapid growth and development that deep restorative sleep is like so important, way more important than an adult. And so if a child's sleep deprived, then it's going to affect their growth. Like certain growth hormone is secreted during deep restorative sleep. So some children actually don't grow and thrive as well because they've
Mhm.
got sleep disordered breathing. Um, it's actually massively linked with ADHD symptoms. So there's different studies. Some are showing 50% link, some are showing 80, 90% link. But either way, if a child's showing ADHD symptoms, then they need to get their sleep checked. So that's going to affect the way they learn, the way they behave, with other children, the way they process information. Um, asthma and eczema, they're linked to sleep disordered breathing. Sort of wet bedding, mental health, so psychologically, there's issues with sleep disordered breathing. So essentially, it's pretty massive. If someone's got sleep disordered breathing, or they're not breathing correctly, and they're not getting the good quality deep restorative sleep that they need, basically everything's going to be impacted, from the way they feel about themselves emotionally, mentally, physically, immunologically, cognitively. So everything's affected, and so therefore it's going to massively impact someone's quality of life if they have this disorder.
Okay, and then how do you personally approach conversations with patients when raising concerns about potential sleep-related breathing issues, particularly when the topic may feel unexpected or sensitive at times?
So it's sometimes quite an intangible topic to think about. So I
Yeah.
think it's really important that you go back to the basics, and it's everything then leads on to the next. You've got to really paint the picture for the parents. So for
Yeah.
example, you've got to explain the basic pillar of health, the importance of nasal breathing, and how nasal breathing helps to actually shape the face, shape the jaws. It improves oxygenation by 18% just by breathing through your nose. It filters the air, it warms the air. So you've got to explain the benefits of nasal breathing first, to then understand why mouth breathing is an issue. And
Yeah.
once you sort of paint the picture and you build, it's like a building block. You know, the nasal breathing is important. The mouth breathing is bad because it's letting all this, it's letting all the infiltrated air in, but also it's constricting the airways. And then you build up the next picture. Then once you've kind of created the picture and parents understand, then they get it, and then they want to get involved because they know they understand the importance of stopping the mouth breathing in their children and sort of resolving the issues that they've got, because all parents ultimately want the best for their children. So it's just about educating them and getting them to see the bigger picture. And to be
And
honest, most of them then will be like, "Oh, my husband's snoring," and you know this, and then you know it opens their eyes to all sleep issues, not just in their child, but in the adults and you know and themselves. They're like, "Oh, maybe I should do this because I'm not, you know, I'm waking up feeling really unrefreshed and things like that." So I think you just got to explain it. It's education.
what are the most common misconceptions you encounter when discussing airway health with other clinicians?
Misconceptions. I think that it's people might think it's all just ENT, or you know, it's not, that dentists shouldn't be included in this whole picture. But I think dentists play a really important role. I think they're the first, in fact, I think they're the first line defence against this,
Mm.
because we actually see healthy children really regularly, whereas other healthcare professionals only see children when they've been referred to them or there's something wrong. So we have got the privilege of seeing these healthy children and screening them so that we can, then we can, you know, sort of open up other referral pathways to help this child. So I think that's the first misconception, that we're just dentists and we're just dealing with teeth. Well, it's not really. We're actually oral physicians, I guess, and we're the kind of gatekeepers to the body. The mouth's the gateway to the body. So that's the first thing. The second thing, people almost, I think, want to overcomplicate things. I think the
Right.
fact that it's just nasal breathing almost seems too simple. And like where your tongue rests, like tongue position, people just think it's just like, what is that? But it's so important. So I think people just think they want, they think it's not sexy. It's just like the tongue position and nasal breathing. It's not really sexy and it's too simplistic.
Yeah.
I think so. That's what I think is part of the issue. So yeah.
And for delegates attending your session in May, what practical steps or mindset shifts do you hope they can immediately implement in their next clinic session?
After my session, the great thing about it is that as soon as they get back to the clinic, you know, if it's on the Saturday, as soon as they're back in the clinic on the Monday, they'll know what to look for, they'll be able to screen, and I'll discuss one. So obviously, sleep disordered breathing is like a very complicated jigsaw puzzle, and dentists are one part, ENT are only one part, and you know, myofunctional therapy are one part, and orthodontists are another part. There's lots of different people who are who are needed within this jigsaw puzzle. But as general dentists, I will teach them how they can use an appliance called the B-Bite appliance, which helps children to breathe through their nose, and it helps to train the tongue to sit in the right way. And so they'll be able to, as a general dentist, they'll be able to provide these appliances as soon as they've like done my lecture and they kind of get it and they start screening, you know, in clinic. And so it's a really good tool for a general dentist to have in their back pocket, that they can provide to a patient and help them like literally the following week.
And what are you most looking forward to this year at Dentistry Show Birmingham?
So I think dentistry is changing and it's evolving, and I think people now are becoming more, you know, I don't want to do it in inverted commas like holistic, because it sounds a bit woo
Yeah.
woo and a bit, oh, but that's what it is. That's what medicine should be. Medicine should be looking at the person, not just the mouth, not just the
Right.
ear, not just the arm, not just the blood. So we should be looking at them because they are a person, and it's, you know, there's, you know, the mouth isn't separate to the body. So I'm really looking forward to, like, you know, connecting with really um, sort of forward thinking dentists who want to, you know, have more mouth body connection, and, you know, want to start checking, you know, like vitamin D testing and this, you know, just different things that we can incorporate to basically benefit our patients and make them healthier. You know, rather than just requiring on just rather than them just relying on the national sick service, as everyone calls it these days, rather than the national health service, because you're only treating diseases, you're not doing any prevention.
Yeah.
It's all about sort of preventing these diseases, you know, connecting with dentists who are forward focused. And I think it's a really exciting time to be in dentistry right now. So yeah, I'm looking forward to kind of, I'm excited to be a dentist, and I'm looking forward to meeting some similarly minded dentists at the show.
And is there anything else, any final words you'd like to share with delegates ahead of your session?
I would say, even if you don't see children, it's just, I think, come and listen to my session, because it's such, as I said, it's such an important, like, sort of basic pillar of health, nasal breathing, and how that impacts our body. And so even if you don't treat children, or you haven't got any children, you'll know, you might have nieces or nephews, you might have like friends' kids, and also yourself, you might not be breathing as effectively as you could be at night. And so you could be optimizing your health and your body just by listening to what I've got to say and connecting the dots about how a person breathes and how that impacts their body. It's just sort of, I think it's just a really interesting topic, and it kind of makes sense as well. Like, even if you've not really heard about it before, if you listen, it really does make sense. Yeah, I think it'll be an interesting talk.
Great. Thank you, Megan, for your time. Much appreciated.
No problem. Thank you for having me.
Thank
And
you.
I look forward to the 15th and 16th of May.